Between the 1st and 5th of June 2015 is the Talk About Medicines Week at Nottingham University Hospitals. This week is your chance to improve medication safety for patients by getting involved in conversations between staff, patients and carers. As part of this week, we are organising medicine safety huddles, which we are asking the medicine safety champions to lead on. To lead on the huddles, the medicine safety champions will need to plan a date or time in the Talk About Medicines week with their ward pharmacist and a prescriber on their ward to undertake the huddle. The huddle should take no longer than 15 minutes, and the medicine safety champion will be provided with a proforma to follow and complete. They should then give this to the pharmacist immediately after the huddle, which will then be returned to the medicines education group. The proforma is freely available and is based on the NUH Safety Conversations proforma, but in this case particularly focuses on medications on the ward. Please note that because you are asking questions related to medication safety, you have a responsibility to ensure that any responses that pose a risk to patient safety or quality of care should be rectified and escalated to the appropriate individuals immediately. The proforma tells you everything that you need to do, but just to give you a quick overview, the medicine safety champion needs to pull together members of the ward team, including the pharmacist and the prescriber, and introduce the conversation to them all by reading out the following. NUH is committed to ensuring the safety of our patients, and the point under discussion here is medications. This session is confidential and purely to provide a forum for discussion and learning about medication safety issues. We want the thoughts and opinions of staff and patients on the ward. There are 4 questions in total, the first 3 for staff and the last for patients. Please record the job role of the person who provides the responses as you go through. We're now going to watch an example conversation between a pharmacist, a medicine safety champion, and 2 members of the ward team, including a prescriber.
Tell us about any recent medication issues on this ward.
I'll go first. My issue, from a pharmacy point of view, is the drug room door is always propped open. So from a security and point of view, that's quite a big deal. Yeah. And it irritates me because every time I move the obstruction, a few days later it will be back there again. So I'd like that to be something that we could fix.
What is it that's propping it open normally?
Usually the pharmacy box.
Right, okay.
So we need to find a way of trying to get those drugs in the cupboards first and lock the doors. Mm. Because we're breaching the policy otherwise.
Yep. Mm-hmm. One of the issues from my point of view, and I know from the medical point of view, is the giving of prescribed medications in an emergency. So prescribing medications and actually then being given by the nursing staff in a timely manner, which I know is difficult when there's lots going on. But there's been a number of occasions where they haven't necessarily been given as quick as we would have hoped to. And I know in certain cases a Datix form has been filled in for that, but not all cases. But I think that a lot of that is communication between the doctors and the nurses as well.
So when it's prescribed, then the nurse hasn't been told. So,
yes, absolutely. And it's not necessarily been stipulated how important it is actually to give that drug and that it is actually an emergency. And that needs to be a priority.
Yeah.
Okay, so that's quite a good one actually, isn't it? One that we see a lot. So perhaps some communication. Yeah. Maybe we could speak to the ward manager to see if she would want to do some promotion around that.
And mine's down to communication as well.
Okay.
TTOs, when our doctors have written TTOs, letting us know that it's been written. Okay. So then we can pass the drug card physically on to the pharmacist. So then it gets done a lot quicker. Okay. Because if we're not the middle person, we can't help that patient get home. Yeah. So all down to communication.
Yeah.
Okay. So that's our mission then, isn't it?
Communicate.
Okay.
Okay. Next question.
What does the critical drugs list mean to you?
So critical drugs. Critical drugs to me mean that that's an example being those emergency drugs being given timely. They are the drugs that, to me, need to be given on time or ASAP, because unless you've got very valid reason for not giving them, some potential contraindication, because not giving them might severely detriment the health of the patient. I think the classics, the epileptics, isn't it, and the Parkinsonian medications, amongst antibiotics and sepsis and things like that. I know for a fact that the medics are often aware of what the critical drugs are, what a critical drug is, but might not know which drugs actually fall into the critical drug.
Especially because there's a NUH specific critical drugs list.
It might be different to other hospitals as well.
Exactly. Yeah. So that's my interpretation. There's a critical drugs list, but there's an NUH critical drugs list, which that's what it means to me. The NUH list is the one I would refer to.
Yes, yeah, and it's about accessing it as well. How to actually access it on the. A lot of people don't actually know where it is on the internet. I think that's education as well, and pointing out or showing somewhere directions to actually easily find it, maybe.
Yeah. And it's also knowing when they're given, and how to access them when a patient's new to the area. So how to get hold of the drugs through pharmacy if the patient hasn't got any of their own. From a nurse's point of view, how you get hold of that drug.
So that one's a difficult one to have any immediate action, and maybe we can let the medicines education group follow that up after this.
Yep. How could training in prescribing, dispensing, administering of medications be improved?
Okay, so from a pharmacy point of view, there isn't very much in the way of ongoing updates or training for pharmacists. So that's something that I think is missing, and it would be good to see some sort of training specifically around the clinical review of prescriptions that we do. So there's nothing at the moment. So there's a bit of a lack. Yeah,
I'd love to see more interprofessional learning between the medics and the pharmacists and the nursing staff, all three together. And I know that the simulation centre's just started doing some pharmacy F1 teaching of simulation, which goes down very well. But many of the junior, new trainee doctors, F1s or so, don't really know what the role of a pharmacist is and what they can actually offer on the ward, and how to contact them if they're not physically on the ward, actually how to contact them. So it's getting them all in the room together somehow and teaching them all together, which again is something for potentially Meg to look at.
That's a really good idea.
But that's also part of the foundation school to look at as well. You could feed that back, obviously.
No, to all work together as well, even in ward rounds and stuff, to work together.
That's true.
That's it.
Okay. So the last question is to
our patient.
Okay, let's go and see the patient. The final question relates to a patient. Please ensure that you have got consent from the patient before you ask them the questions. The answer can be from the patient or their relative or carer. And remember, you must rectify, report and escalate any patient safety issues that arise. So hi Mark, thank you very much for consenting for us to speak to you about your medications today. I've got a question for you. So while in hospital, have you been receiving any medicines?
I have, yeah.
Okay, and have you had any concerns about the way we deal with your medication since you've come into hospital?
Well, the fact that I've been given these medicines but no one's explained what they're for.
Okay.
So obviously, I'd like to know.
Like to know what your medication's for? Okay.
Definitely.
Any other concerns?
I brought my own medications in with me, and since I've been in, I haven't seen them.
Haven't seen them.
And clearly, if I need them, how do I get them?
Okay. So let's address those concerns for you. For the first one about the medications we've been giving you, more than happy myself or one of the other members of medical staff to sit down and talk through which medications we're giving you, why we're giving you them, when we give you them, what they're for.
Yeah, that'd be good.
Ideally, that's something we should do with every patient when we give them a medication, to let them know why they're having it. It keeps you in the loop about why you're having these things. With regards to what's happened with your medications, I'm sure the ward staff will be able to let you know where they are.
Yeah.
Your medicines will be locked away for safety. They should be in your bedside locker. When you leave hospital, we will return them back to you, and we can sort that all out for you.
Okay, brilliant.
Thank you for watching this, and we hope that you have some useful conversations related to medication safety. Remember that any issues must be rectified immediately to ensure patient safety. Any questions at all, please contact the Medicines Education Group via the email on the picture in front of you.